Hello guys, welcome back to my YouTube channel Knowledge is Power. Today I am here with you all to discuss about needle stick injuries. Have you ever heard that the healthcare professional working in a hospital accidentally they may get a needle prick? So today we'll discuss about this topic, how we can manage needle stick injuries, what are the risk factors of needle stick injuries, and what are the sources from where the healthcare provider they can get needle stick injuries. So without delay, let us start with our today's topic. The needle stick injuries are the injuries that a healthcare provider get injured from needles used in medical procedures, or sometimes called as needle stick or serp injuries. Serps can include other medical supplies such as syringes, scalpels, lancets, and broken glasses in the form of ampoules and vials. If someone has got a needle prick in the hospital setting, there is a high chance that the person may suffer from hepatitis B, hepatitis C, and HIV infection. Therefore, let us know how to reduce those needle stick injuries. Firstly, you should avoid using of needles where safe and effective alternatives are available. Secondly, we shouldn't recap the needles after using it. During handling of needles, one should be very careful and it should be promptly disposed of only in sharp disposal containers. In the hospital settings, the sharp needles are discarded in the needle proof or puncture proof container, that is the white bucket, according to the BMW rule as per 2016. All the healthcare provider working in a hospital settings must take 3 doses of hepatitis B vaccine. It gives lifelong protection. Also, taking the post exposure prophylaxis in the event of any occupational exposure or after any event of needle prick injury. Let us know what are techniques used in India for disposing the needles. Generally, in hospital settings, the healthcare workers they use needle destroyer, burner, or cutter. Disposal of subs into the appropriate bin, and as per the Biomedical Waste Management 2016 already I have mentioned, white color bucket or puncture proof bucket is used. When do needle sticks happen? It has been seen that 70% of the cases occur after the using of the needle and before the disposal of the needle due to the carelessness of the healthcare workers. 20% of the cases it occurs before and during the use. 10% of the cases it occurs during and after disposal. When do serp injuries occur? The majority of the needle sticks occur when healthcare workers dispose the needles after using it, administering the injections, withdrawing blood. They can have a needle prick injury. If the healthcare worker they try to recap the needles, then there may be chances that they can get needle prick injuries. And if they handle the traces without any precautions, and if the linen is dirty, then also they can get a prick from the needle. Now let us know who are the workers that are at high risk for bloodborne infections due to needle stick injuries. The healthcare workers with frequent blood exposure are nursing staff, nursing students, physicians, surgeons, emergency care providers, dentists, interns, and medical students, labor and delivery room personnel, laboratory technicians, health facility, cleaning staff, and clinical waste handlers. Ultimately, we can say all the healthcare professionals may get needle prick injury if they are not following certain rules and regulation, if they are not following certain precautions during their clinical practice. Suppose a healthcare provider they got needle prick injury, they should have sufficient knowledge regarding the management of the needle prick injury cases so that they can help themselves and others during such accidental cases. So let us learn some management of needle stick injury. First and foremost, the person who has got needle prick, we shouldn't get panic. We should advise the person not to get panic. We should try to make the patient cool and calm. We shouldn't put the finger in mouth or squeeze the wound to bleed it. Then immediately we should wash the wound and surrounding skin with soap and water and then rinse it. We should not scrub or use any kind of bleaching, chlorine, alcohol, betadine, iodine, antiseptic or detergent or any antibiotics on the wound. If eyes are involved, wash immediately with running water. If mouth is contaminated, rinse with plenty of water. When massive contamination of unbroken skin is occurred, remove all contaminated clothing and washing off all the affected areas with plenty of water. A mnemonic to remember whenever a person is having sub injury or needle prick injury: first, bleed it. Immediately after any kind of needle prick injury, if the person is having bleeding, you should wash it with soap and water immediately. Then you need to cover it with transparent waterproof micropore. Then you need to report it immediately to the higher authorities. Coming for the next slide, here is a flowchart of the needle stick incident. If the skin, wound or non-intact skin is affected, you should wash with soap and water without scrubbing it. Already I've mentioned. Then you shouldn't use any kind of antiseptic or any detergents. Then free bleeding of the puncture wound should be encouraged gently, but wound shouldn't be sucked. Cover the wound with a waterproof plaster, notifying the pharmacist in charge of the incident, contacting the local accident and emergency department for advice, then recording all the details of the incident, including the affected individual's name, address, date of birth, in the needle stick injury form. Now, let us revise how to reduce these risks. Number one, the level of precautions to be taken for any procedure must be determined according to the extent of possible exposure to blood or any kind of body fluids. Never re-cap the needle, already I have mentioned. Then disposing the needles in the approved sub container, disposal container immediately after use, avoiding handling of such devices by a second person. Then all served boxes must be sited as close as practical to where the serve is to be used, but not left with in near the children or adults who may be at risk. Never try to retrieve anything from a serve box. Try to label the sub box separately. Use completely disposable sub where possible. Another important thing you should keep in mind is that you shouldn't overfill the sub box. When the sub box is half filled, at that time only you should discard the needle in the sub burial pit. Coming for the very important point, post exposure prophylaxis. That is, whenever a person is getting any kind of needle prick injury, he or she needs post prophylaxis therapy. Immediately after needle prick injury, if the needle prick has occurred after providing any kind of clinical procedures to the patient with hepatitis B or any kind of bloodborne disease, immediately the healthcare provider must take post exposure prophylaxis. Post exposure prophylaxis is the use of antiretroviral therapy prophylactically to prevent HIV infection or any kind of bloodborne infection after any occupational exposure to the healthcare provider. Let us know the general guidelines for post exposure prophylaxis. The potential benefits weighed against potential risks and informed to the staff. Adverse reactions are monitored. Follow up, counseling and HIV testing, monitoring for drug toxicity. Now, talking about the treatment, if the healthcare professional thinks that they are at low risk of infection, or if they are sure that the person from which they has got the contact are not hepatitis B or not having hepatitis C or any kind of infection, bloodborne infection, then there is no need of prophylaxis treatment. On the other hand, if there is a higher risk of infection, the healthcare provider who has got the needle prick injury, they need antibiotic treatment. For example, if the skin got infected with cellulitis after the needle prick injury, the vaccination against hepatitis B, the healthcare provider also need the treatment to prevent HIV. If there is high risk of infection with HIV, the healthcare professional may consider treatment called post-exposure prophylaxis, already I have mentioned. Hope you all guys got brief idea how to manage needle stick injuries if it has been occurred in the healthcare settings. So without much delay, please share this useful video among your medical friends, nursing friends and CHO friends working in HWC. Thank you guys for watching this video. Hope this video will be helpful for you all. If you find this video useful, please don't forget to click the bell icon below.